All right, so the first thing I want to do is to talk about the difference between class versus National Registry style questions. My name is Dan Limmer from Limmer Education. You may have heard me talk about this. You may have heard me say, your classroom exams are nothing like the National Registry. And that's one of the issues. People get to the National Registry and their head blows up. We can't have that. So what I want to do is I want to show you the difference between this National Registry style question and classroom questions. And I want to start with a classroom question. All right. You can see that on your screen right now. And one of the first things that you see is, holy cow, is this question voluminous? I mean, look at the size of that question. National Registry questions are generally maybe 2, 3, 4 on the outside sentences. So let's see if we can take this apart a little bit, because I think if I show you this one first, you're going to see the difference between the class and the National Registry style exam questions. Therefore, it will be less foreign to you when you get there. The National Registry doesn't put in anything that's not important. It's a dark and stormy night. Yep, who cares? It has nothing to do with the patient. You and your partner are called. Well, I think that's why they call it a call, right? So we can get rid of that too. We really don't need it, right? So you have a male patient. Oh, wait, if you're treating this person, they're a patient, aren't they? We don't even need the word patient in there. But this is how the National Registry parses down questions. But what you'll also see here in National Registry style questions is you'll see the age of the patient, right? Because we've got this male, and you see he complains of substernal chest pain. It's a difference if that's a 17-year-old male or a 67-year-old male, right? That actually makes a really big difference. So we will put the age in there. Now, who complains of substernal chest pain? That's totally good. He describes it as crushing and radiating to his neck, jaw, and left shoulder. Okay, well, what that really does is that hands it to you. I mean, it really hands it to you. You really can't say cardiac any more than that. And I'm not sure how much of that is really necessary, right? Because we have to kind of keep this minimalist. Remember, the National Registry tests judgment. So you're going to see when we get to the choices, how much of this is really necessary. He's pale and diaphoretic. He has a history of hypertension, MI, and diabetes. Okay. Well, I mean, that kind of hands it to you too. The MI is quite, now, not that he couldn't have a history of MI, not that some of these things wouldn't be in there, but pale and diaphoretic, that kind of indicates criticality. When we look at the choices in this question, um, here, it doesn't really matter whether he's critical or not, because all we really talk about are medications. And this probably isn't going to affect a lot of that, right? He has a history we talked about. He denies difficulty breathing. That might be significant because one of the choices is oxygen. Now his vital signs are pulse of 92, respirations are 18, blood pressure is 118/72, pupils equal, round, react to light. Pulse oximetry is 95%. Whoa. So, I mean, all of this space has to do with vital signs. I'm going to show you how the National Registry is going to tighten that up a little bit, because this question is going to come down to 3 lines by the time it's done. We're also going to change the choices. But let's look at how we wrap up here. In this patient, the first thing you should do is, all right? So first of all, the National Registry is always going to ask you what you should do. It'll never ask you what you would do, right? Because if it said, what would you do? Anything you say would be correct, right? But you don't see capital letters, right? And of course it's in this patient. We're not talking about another patient. So ultimately, what do we have? You should. Well, now we've given all this information, and basically they're looking at what should you administer, right? And in this case, if we just look at this, you've got we'll say a 67-year-old male who complains of substernal chest pain, has a history of hypertension and diabetes. These are risk factors for an MI, certainly. He denies difficulty breathing. Well, that's probably significant because that's going to make us say we don't want oxygen, right? Because the SATs are 95%. And the pupils don't really change anything. But do I give nitroglycerin? Do I give oxygen or aspirin? They're wanting to know what's most important. And ultimately, what would you do, or what should you do ultimately, is oxygen by non-rebreather mask isn't the answer. And uh, oxygen by non-rebreather is definitely not the answer. But now you have aspirin and nitroglycerin. Well, a patient might get both of these things. Um, if he was pale and diaphoretic and he had a rapid pulse, you might want to be a little bit more cautious with the nitro. But ultimately, when they say you should, ultimately it's you should first. Of these things, which would you do? And quite frankly, the answer is aspirin. Aspirin stops platelet aggregation. You can chew those up, and you'd give those before nitro, before oxygen, even before vital signs in theory, right? I mean, it's aspirin's the most important. So this is what you might see in class. And one of the reasons the National Registry doesn't do questions like this is that this, to a certain extent, tests reading. And we don't ever want to test reading. We want to test your clinical knowledge. We want to test your judgment. And this is basically craziness, all this stuff in here. You really don't need it. You didn't need all this information to say, what do you do for somebody with chest pain? Well, we give them aspirin. Then the other stuff. It's really that simple. So let's go down and look at what this question might look like on the National Registry. Holy cow. All right, now I'm just going to scroll back up one more time and just show you what the question used to look like and what this question really will probably look something like on the National Registry. So what do we have? We have the age, and he's male, substernal chest discomfort. Okay. His past medical history includes hypertension and diabetes. Those are risk factors. Vital signs. Look how neat these vital signs are now. Pulse of 92, respiratory rate of 18, 118 on 72, and setting at 95%. You should. Boom. It's the same question. People say, oh, the National Registry tricks you. It does this, it does that. No, they want to test your judgment. And they don't hand it to you. If you're going to go out and be an EMT or an AEMT or a paramedic, you really should be able to make decisions. Ultimately, what this is about. So in this now, we're not testing drug doses like on the prior question, right? We're not doing that. Now we're saying, what are my choices? Do we give oxygen? Do we put the patient in a supine position? Do we administer aspirin or do we transport emergently? Now we're looking at big picture, right? Well, if I look at this, I'm going to say, and I might be able to narrow this down to two. That's kind of what we're always told to do. A patient who has substernal chest discomfort, he's going to go into a position of comfort. And I don't think he really wants to be in a supine position. He may or may not have fluid in his lungs. He may or may not have difficulty breathing, right? There's no indication of difficulty breathing in here. So because of that and the saturation at 95%, I'm going to say, I'm not sure I'm going to give him oxygen. It doesn't really say he's in any distress of any kind, except for his substernal chest discomfort. So now do I administer aspirin or do I transport emergently? See, this is what happens. Now we have to decide. So you should, well, should do both. But what would I do first? I would have that patient, while I'm preparing for transport, choose some aspirin. Why? Because it limits platelet aggregation and it is better for my patient. It may stop the progression of the MI if there is one. The American Heart Association guidelines that recently came out really emphasized aspirin and the importance of aspirin. We're not testing the dose. We're not getting picky about what it is. We're just looking at what should you do. Well, and emergently, even the word emergently should, promptly, do we, priority transport, might that be better? Is it better to grab this patient and jostle him down the stairs and bounce the stretcher and scream to the hospital with lights and siren? That probably isn't going to do very much for him either. Ultimately, what do? We administer aspirin. And that's what this question really wants you to do. Now let's look at the question up above one more time. In here, it's crazy to read. It really kind of hands you the answer, I think, right? And we're not necessarily looking based on this to figure out if we give oxygen by non-rebreather, oxygen by cannula. This is just full of blah, blah, blah. But then we see a tight question. We see something that's going to be a little bit tighter, more succinct, something that tests our judgment, like what do we do? And this is more of the question that you're going to get. Now, when it comes down to protocols, the other thing that this does is this becomes very protocol neutral. Let's say your protocol say give you choose your patient choose 2 baby aspirin. Other protocols say 4 baby aspirin, 162 versus 324 milligrams. The National Registry doesn't want to test your protocols or confuse that. They want you to identify what the priority is here, what the judgment is, what science says that we should do. And what's the most important thing here is to have them choose some aspirin. And that's because your books say it, the American Heart Association says it, and that's really what this is about. So this shows you the difference between a classroom exam and National Registry style question, not only in the way they're written, but in the judgment and the things that they demand.